Hi, welcome, and thanks for taking a look at this topic. I think it's an important one. My name is Schaefer Bader. I'm an endocrinologist at UC San Diego, where I work with Steve Edelman. And today, we're going to be talking about heart health and how it relates to diabetes. It is a very important topic, and I hope you'll learn something and come away with some information that can help you reduce your risk for heart disease. So let me just, without further ado, start this PowerPoint, and we'll get going. So this is a talk that is supported by No Diabetes by Heart, and this is a sort of a joint effort from the American Heart Association and the American Diabetes Association to improve education knowledge about heart disease and ways to reduce the risk for heart disease. And so that really is our whole goal today in this talk. So it's organized sort of in an approach using the ABCDs, and the reason that it's organized that way is just to kind of help you remember these different topics and these areas that we're going to talk about. But don't be confused. This isn't kindergarten. This is real life stuff that's going to help you sort of learn about why we care about the ABCDs of heart health and what you can actually do to be healthier and protect your heart. So it's important to know that actually controlling these ABCDs of heart health can reduce your risk of heart disease, heart failure, and stroke. Okay, so that's the good news. There's actually something to do about this to reduce your risk. Now, some of the bad news. So we know that among people with diabetes, that heart attacks and strokes, cardiovascular disease, is the leading cause of death. Now, the reality is that actually that's the leading cause of death among all people in the United States, whether you have diabetes or not. But unfortunately, people with diabetes are roughly 2 times higher risk for cardiovascular disease than the general population. So heart disease is a big deal for everybody, but it's an even more important thing to consider if you have diabetes. And so that's the bad news. But the good news is, as I mentioned before, there's actually some things we can do to reduce your heart disease risk, and the risk for heart attacks and strokes. Okay, so that's what we're going to be focusing on today. What can we do about this? And it starts with education. So the ABCDs, we're going to talk about each of these sort of individually in order, but just to introduce you, A is for aspirin, and also for A1C, which is basically your glucose control. Okay. B is for blood pressure. C is for cholesterol. D is for diabetes drugs that can actually help reduce your risk of heart disease. And then E stands for eliminate smoking. Okay. So let's kick it off with A. All right. So A is for aspirin. And when we're talking about aspirin, we're really talking about normally a baby aspirin. It's 81 milligrams once a day. And it's used as essentially as a preventive a way to reduce the chance of having a blood clot in the heart or brain that oftentimes will cause a heart attack or a stroke. And it does that by acting as a mild blood thinner. Okay, it's effective in doing this. It's inexpensive. So for a lot of people, it's a really good idea to be on a baby aspirin every day. The question is, who should be on a baby aspirin? And it's not necessarily everybody, okay? So we do recommend that people who have both diabetes and known heart disease, so if you have both of those things already, unless you have a reason not to take aspirin, you should be taking it, okay? So we recommend that. Also, for all people who have diabetes and are over the age of 50 and who may have some other risk factors for heart disease, things like strong family history of heart disease, history of smoking, really high cholesterol, things like this, okay? And you're going to be hearing me say this a lot today, but talk to your doctor about this. If you're not taking a baby aspirin or a daily aspirin, ask your doctor if you should be, and don't just start taking it without talking to them, because there are some people who shouldn't be on an aspirin, and in particular, those are people that are at increased risk for bleeding, okay? Because these, again, the aspirin acts as sort of a blood thinner. And people who have had gastrointestinal bleeding or bleeding in the brain are maybe shouldn't be on an aspirin. So talk to your doctor about it. And if you hadn't had a chance to read it, I do really like this cartoon. The wife's sitting at the hospital bedside, and she's telling her husband, "The doctor said you've been whining about taking a baby aspirin every day, so he's switching you to a crybaby aspirin." And that seems to hit close to home. So the other A is for A1C. And the A1C is a number that you should know if you have diabetes, okay? You should know what the A1C is, and you should know what your A1C is. So the A1C in general is a measure, a blood test that we use to get an estimate of what your blood sugar has been over the past 2 to 3 months. Okay, so sort of like an idea of an average blood sugar over the past couple months. And if we look here at this chart, it gives you some idea what that means. So, as a general goal, now everyone's A1C goal can be different. That's another thing to talk to your doctor about. If you don't know what your goal A1C is, have that conversation with your provider, your healthcare provider. But sort of a starting point or an average A1C goal is around 7, or maybe even a little less than 7. Okay, and just to give you an idea, that A1C of 7 should match up with an average blood glucose of right around 150. Okay, so if your A1C is 7, then your average blood sugar most of the time is right around 150. Of course, you'll have higher ones and lower ones, but that's the average. Okay, and as the A1C number gets higher, it matches up with higher average blood sugars. Okay, so that'll give you some idea. If you can always look at this chart, you can always Google, A1C average blood glucose if you want to look up and see how those numbers match. So, again, talk to your healthcare provider about what your A1C is and what your A1C goal is. Okay, but it's a measure of your glucose control. Moving on to blood pressure. Okay, we all know hypertension is related to heart disease, so it's really important to think about this. And again, this is another area where you have to kind of be educated on your own numbers, right? So what are your blood pressure numbers? Where do they normally run? And kind of what's your blood pressure goal? And across the board, this number changes a lot. Every couple of years, it seems like they come out with a new number in terms of a target blood pressure, whether it's 120 over 80, 130 over 80, but it's kind of in that range. So, I think 130 over 80 is a good target blood pressure. And if most of your blood pressures are below those numbers, then you're in a good, safe place, probably where you're not overworking your heart. So, certainly blood pressure should be measured every time you go into the doctor's office. And, especially with COVID going on, people are going to the doctor less and minimizing that, and maybe even doing telemedicine. But it's always a good idea to get your own home blood pressure cuff and check your blood pressure at home, because that represents your real life. Sometimes if you go into the doctor's office and they check it once and your blood pressure is really high, or maybe it's great, but maybe that doesn't match up with what's going on at home. So check it at home, write those numbers down, keep a log, and then let your provider know, hey, I've been checking my blood pressure. This is where it's at, on average every day. So that'll be a more useful piece of information. What's a good blood pressure? Again, talk to your doctor. What's your specific goal? But I think a good place to start is less than 130 over 80, and if you have diabetes. Okay, so that's kind of a general guideline. What if you have high blood pressure? What can we do about it? Well, a low salt diet is important. So a lot of people are salt sensitive, and eating salt basically makes you hold on to fluid, and that pushes up your blood pressure. So reducing the salt in our diet, that's been a guideline for a long time, and it's very true. We want to eat, fruits, vegetables, healthy whole grains, lean proteins, right? So this is, relatively low fat meats, and also things like fish, beans, and nuts, so we can get that protein without the fat content. Minimize, in particular, saturated and trans fats. So those are sort of the unhealthy fats that can contribute more to clogging up the arteries, as well as things like added sugar and processed meats. And not just processed meats, but processed foods in general, we want to be careful with, especially things like processed meat, which is like sausage and stuff like that, and also processed carbohydrates. So a lot of our snack foods are just highly processed carbs, and those tend to contribute to cardiovascular disease. Medications play an important role, and some of them also actually protect the kidneys. So blood pressure medicines, things like ACE inhibitors like lisinopril, the ARB medications like losartan. So there's a whole list of those that are good for blood pressure. They're also good for the kidneys. Okay, moving on. C is for cholesterol. And now cholesterol is really important to understand that we have all different types of cholesterol in our body. So always go back to this idea of good cholesterol and bad cholesterol. And we really want to know the difference and which one's which. So the LDL is sort of the classic bad cholesterol, okay? So L is for lousy. We want to keep it as low as possible. So if you look at your lab, let's say your provider sends you your cholesterol labs, and you're looking through them, it should be broken down into things like total cholesterol, which is all the numbers added up. You really want to look at the LDL cholesterol separate and also the HDL cholesterol. HDL is the healthy cholesterol. You want to keep it as high as possible. So higher is better. And then lastly, sort of the other main important component is the triglycerides. And this is also one that you want to keep low. So the HDL, you want to keep high. All the rest of them, you want to keep as low as you can. And triglycerides oftentimes will match up with your blood glucose in a lot of people. So if you have diabetes and your blood sugar is running high, then your triglycerides may also be running high. So treating your blood sugar will actually help lower your triglycerides, okay? In order to know your numbers, sometimes you got to ask for them. So check with your doctor, see if they can send you, either a printed copy or they can mail them to you, or if you have electronic records, maybe you can get your cholesterol numbers that way to keep an eye on them. Figure out what your goals are. And it really does depend on, hey, do you have diabetes? Do you have heart disease? How aggressive should you be? And ultimately, I would say the most important, we want to look at all these things, the HDL, the triglycerides. But I would say if there's one number to look at, probably it's going to be the LDL, that lousy, that bad cholesterol. And this number we want as low as possible. So, depending on different guidelines and goals, less than 100 is a good place to start, but lower is better. There's no such thing as too low. You want it as low as you can get it. And a lot of people, if you already have heart disease, you want it under 70 to reduce the risk of further things like heart attacks. What about statin medication? So statins, there's a ton of stuff out on the internet. There's a lot of different arguments about statins. What we do know is that statins work really well to lower that lousy LDL cholesterol, and they definitely help protect against heart attacks. So, it's all about a risk-benefit ratio, and the benefit of statins is huge. So think long and hard about, if you're thinking about not taking a statin, even if someone's recommending it, please have a really good reason to not take one, because these are really good medications ultimately for reducing things like heart attacks. So if you've ever had a heart attack or a stroke and therefore have some heart disease, then really you should be on a statin. If your LDL is high, then a statin is usually the first medication that we would use to lower that LDL. So that would be another reason to take one. And they also recommend that, most patients who have diabetes who are between the ages of 40 and 75 should be on a statin, as well as people with diabetes who are younger than 40 if they're at high risk. So again, if family history of heart disease, smoker, different issues that may put them at a higher risk, then you may consider being on a statin even if you're under 40. If you're over 75, there's actually just not great data. So that would be another time, hey, if you've been on a statin and it's your birthday and you turn 75, that doesn't mean you should stop taking it necessarily. But again, talk to your doctor about that. And please, please, please do not be scared by this crazy information about statins that you may see on the internet or hear from a friend. There are, real side effects with statins, which I'll talk about in a sec. But, be very careful with where you're getting your information from. Please make sure it's coming from a reliable source. Statins, for whatever reason, are one of these medications that have, gotten a lot of weird sort of theories and ideas and negative information. But the important part is talk to your doctor, read reliable websites. Don't get caught up in the conspiracy stuff. So what about side effects? If you look at the cartoon, the pharmacist is handing this lady like this huge capsule, and he says each capsule contains your medication plus a treatment for each of its side effects. And that's something that we worry about, side effects of medications. So first and foremost, again, always talk to your doctor about these. So if you're having any side effects, even if you're not taking the medication but you're worried about side effects, bring that up. This has to be a dialogue. It has to be a conversation. It's not a one-way decision that your provider should be making. But they don't know that you're concerned about these things unless you bring it up sometimes. So please talk to your healthcare provider. If you're on medications and you're wondering if maybe you're having some side effects, you're not sure where it's coming from, don't just stop all your meds or even some of your meds like your statin or your blood pressure medicines, because that could be a problem and increase your risk for heart attacks. But talk to your doctor about it or your healthcare provider. And really, your healthcare provider should be able to work with you on that and make adjustments, trying different versions of the medication, different doses, switching things around, so to really minimize or get rid of all your side effects. Okay, that would be the goal. All right, moving on. diabetes drugs. So this is actually, in my opinion, a really exciting area because we have a ton of different diabetes medications out there that we use in different types of people for different specific reasons. And only recently have we had a number, actually, two whole classes of medications, each with a whole handful of specific drugs inside of those classes that have actually been shown to reduce the risk of heart disease. And so this is really big news because, as we said before, we know that diabetes is a risk factor for heart disease. So if we have some diabetes medications that both help with blood glucose control and reduce your risk of heart disease, it's a win-win. Okay, so even the cardiologists are very excited about a lot of these medications. So yes, there are diabetes medications that can help lower your risk for heart disease. And so this is really good news. These are the classes. So the first major class is the GLP-1 agonists. And some of the brand names that you may recognize are Victoza, Ozempic, Trulicity, Bydureon, and there's some others out there. And then the second class of medications are the SGLT2 inhibitors with brand names like Jardiance, Invokana, Farxiga, and others. So both of these classes of medications, if you have heart disease, really based on the ADA guidelines, you should be on at least one of these medications. Of course, there's other factors, side effects, cost. All of these different things are important. But if you have heart disease and you're not on any of these medications, then it's a good idea to talk to your healthcare provider, ask, hey, should I be on these medicines? And then, of course, lifestyle modifications and taking all of your other diabetes medications is also important, just because, these ones specifically help the heart, but so does just having good, blood sugar control. So even just all your other, whether it's insulin, metformin, any other diabetes medications that are keeping your blood sugar in a good place are still protecting your heart. Okay, now eliminate smoking. This one we have to say because it's very, very important. Smoking is something that we've known for a long time is very bad. And everybody knows that. It's not a secret. But quitting smoking is extremely, extremely hard. It's a really hard thing to do for all sorts of reasons. Chemical reasons, social reasons. So it's a difficult thing to do. And for those of you who, are ex-smokers and you've quit, that's fantastic. I applaud you. If you're a smoker and you're thinking about quitting, I applaud that too. Okay. And it's a hard thing to do. A lot of people can't do it on the first or second or third or fourth try, but you got to keep trying because it's one of the most important things you can do for your health. This is a classic cartoon showing the real reason why the dinosaurs became extinct, because they were smoking. Figure out whatever it is that, you can use for motivation to quit, whether it's the cost of these things, the health benefits, your family, whatever it is, use that as motivation and find a way to quit if you can. So, we talk about lifestyle modifications a lot, and basically lifestyle is kind of like a catch-all for everything that's not medications in a sense. So quitting smoking, exercise, being fit, moving around, good diet, and these are all extremely important in terms of ways to protect your heart and your cardiovascular health. So, good nutrition. I'm not going to spend a lot of time on this today because we just don't have the time, but it's a very important topic, of course. In some ways, there's a lot to learn about nutrition, and finding a good diabetes educator or a dietitian to kind of talk with and meet with and talk about these things, talk about what you're eating, how to make some important changes. I recommend that if you have the opportunity. But in some ways, we know fruits, vegetables, these are healthy choices. We sometimes, if there's bad food, it's pretty easy to spot that too. So these would be choices to avoid, right? Largely because of the portion size. Okay, too much food. Physical activity is extremely important, whether that's actual exercise, going to an exercise class, doing something that's exercise, or just getting out and walking and moving around. So any of those things are beneficial. Okay, so walking the dog, is great, even if you have to carry the dog. Just so you know, this does not count. Okay, it's good for the dog, but doesn't count for you. This is from Steve Edelman. He always gives the advice: if you're going to go try cross-country skiing, start with a small country. And obviously that's a joke, but it's a joke with a little bit of truth in it, to say that, hey, look, exercise is not something that, we can't all go and run a marathon tomorrow. We, be in perfect physical health. We all have different reasons why we can exercise more or less, but start somewhere. If you're interested in getting more physically active, start small and work your way up. And there's no amount of physical activity that won't be beneficial. So even if you're going from sitting on the couch to, going on a 10-minute walk, twice a day, that's a good start. So move forward in some way in terms of your physical activity. So really quick, just to kind of review all these topics. I know we went through a bunch of stuff. This is just a little bit sort of a knowledge check. So normally we would do this live, and we'd get the opportunity to kind of talk about these things together. But basically, I just want to go through these questions, and do me a favor. As we go through these, once I read the question, think about which choice you would choose. Okay, kind of test yourself as we do this. So here's the question. Having type 2 diabetes increases the risk of developing which of the following conditions? High blood pressure, abnormal cholesterol levels, heart disease, or all the above? So how is diabetes associated with any of these things? Well, it's all the above. So we know that there is an association between diabetes and hypertension, high cholesterol, and heart disease. What's the leading cause of death for people with type 2 diabetes? Is it Alzheimer's, cancer, heart disease, or kidney disease? Well, again, heart disease, right? That's what we're talking about today, and that's the leading cause of death in people with type 2 diabetes, as well as people without diabetes. Just that type 2 diabetes is itself a risk factor for heart disease. Which of the following puts people with diabetes at greater risk for heart attack and stroke? High blood pressure, elevated LDL cholesterol, lack of physical activity, or all of the above? All the above, right? So when that's there, you got to at least take a second look at it. But all of these things increase your risk for heart attack. High blood pressure, we know. LDL is that bad cholesterol. And physical activity is really important for heart health. So lack of physical activity can be detrimental. True or false? People with diabetes can reduce their risk for heart attacks and strokes. What do you think? True, you can. And so it's, it's thinking about all these different things, these different ways, A, B, C, D, E's, to basically reduce your risk of heart disease and strokes. So what to do now? I do encourage you to think about 1, 2, or 3 changes that maybe you would want to make to increase your heart health, to help protect your heart, keep it healthy. And changes that you wanted to make for a while, maybe something new that you just learned about today, maybe something you need to talk to your healthcare provider about. And ultimately, all of these ABCDEs work together to improve your heart health. So, but it's about finding changes and interventions that you can do, that you can maintain over time to stay healthier. Okay. So please check out knowdiabetesbyheart.org for some helpful tips and resources. That's really what this website is all about, is keeping you healthy. There is a sort of a follow-up survey available if you have the opportunity to take a look at it. So take a look at the slide here. And that's it for today. So thank you very much for your time. I hope you learned something. Please be well and please be kind. Thank you. Vape, of course, tobacco. People vape other substances, especially here in California. And the short answer is, there's not a lot of evidence for vaping, but we're learning more and more that it's probably just as dangerous as smoking, or at least it carries a lot of the same risk factors. So there may be some benefits to vaping relative to smoking, but that has not been shown. So we know that it can still cause lung damage, and any of those substances that you're taking in can still have those same effects on the vasculature. So they can still damage, unfortunately, they can still damage your heart and the blood vessels, just like smoking cigarettes would. So, even though vaping, is sort of promoted sometimes as a healthier alternative to smoking, we haven't really seen that. And the more and more evidence that comes out from vaping, we see that these risk factors are still present, unfortunately. I did want to talk about statins. So Roberta Crane mentioned that she had really severe muscle pain with statins, and that's one of the real potential side effects with statins. So that is a well-known issue. It doesn't happen in that many people. I mean, in terms of the percentage of people, it's a small percentage, but that's a real issue. And so if you've tried multiple different statins and you've had really bad muscle pains or myositis with that, then that can actually happen. And that's a reasonable reason to not be on a statin. But if you still need to be on a medication, if your cholesterol's high, if you have diabetes and you're worried about your heart risk, then there may be other alternatives. So especially if you've tried multiple statins and you can't take them, you can't tolerate them because of side effects, then you can ask your doctor about something called Pcsk9 inhibitors, which are some of the newer medications that are really powerful at lowering your cholesterol levels. We didn't talk about those much today, partly because they're really expensive, they're very hard to get, but they're a good alternative for people who just cannot take statins at all. Let's see. What else can we talk about? Red meat. There's a question about red meat and, what I counsel patients about red meat. And I think this is sort of an interest purely from a health standpoint. Red meat has some benefits. It does have protein, it has iron and some other positive benefits. It also tends to have higher levels of saturated fat. So people who eat a lot of red meat, multiple servings of red meat all throughout the week, or even worse, multiple servings per day, actually are at a higher risk of heart disease. Some red meat in moderation probably does not have that high of a risk. So from a cardiac standpoint, I think red meat is one of those things that we'd put in the eat with moderation category. So there are other probably slightly healthier options to get your protein in, things like fish, legumes, beans, things like that. But I think if you enjoy red meat, having some red meat, and also pork would fall into that same category, the other white meat, so to speak, in moderation. Let's see. This is a question from Trisha Davis. At what point should I get baseline cardiac data, like a stress test, done if you have type 2 diabetes with hypertension and cholesterol? So, there aren't really any guidelines to get something like a stress test done at any point, just because you have diabetes, even though diabetes is considered a risk factor, certainly for heart disease. The problem is that we don't know when it's beneficial. And so, doing a stress test may not really show any problems, even if there's something developing very slowly. And usually we just wait until there's some reason to get a stress test. So a lot of times, even the cardiologist won't get a stress test in people who have multiple risk factors if they're otherwise healthy. So, maybe they'll look at an EKG or do something like that, but doing a full-on stress test without any history of health problems is not something that is generally recommended. There's a question about fish oil. I don't use the SIP. I don't know about it. This is from Monty. But fish oil actually is proven to help reduce triglycerides. So if you're someone who has high triglycerides, first of all, you can increase the intake of fish oil through eating fish, right? That's actually a healthy alternative, part of, for example, the Mediterranean diet. So eating fish oil, by eating fish or taking fish oil capsules, can in many cases help lower triglycerides, and that's been shown. So if when you're looking at your cholesterol numbers, if the triglyceride level is high and that's something that you're working on, then fish oil is a good option for you. Susan asked if it's possible to get a blood panel at home to avoid going into the lab at this time, during COVID. I think that's a really great question, and one that, probably depends on where you live and the coverage that you have. In general, it's probably not that available for people. Even here in San Diego, where people with really good insurance, there's not necessarily a way to get labs drawn at home, unfortunately. So I think that's always a balance of are you taking risks going to get your lab drawn? Do you need the labs drawn? Is now a good time? Do you have some relatively recently? Or, hey, have you made changes, a new medication, and you need to kind of really get some safety labs drawn and see if these medications are working for you? So it's kind of a personal choice, but there's not necessarily a perfect solution right now. What else do we have? So there's a question again. Let's see. This is a good question from Laura. So how much is stress a factor on heart health? And I think Laura's just talking about sort of psychological stress, being stressed out, dealing with, all of these things that are going on right now between COVID and politics and all this stuff that just kind of is, ever present in our lives and is stressful. And I think that it's probably, stress is probably an underappreciated and an under-discussed factor. And I'm sure there's some good studies out there, but it's not something that we have the kind of data that we have, on things like smoking, where it's very clear. But certainly stress levels are important for your heart health. So finding ways to de-stress, which is easier said than done, especially in these times, but things like doing exercise, eating healthy, making sure you're getting enough sleep, finding options like meditation or yoga or different things like that that can help actually reduce stress, have been shown to actually benefit the heart. So those are actually really important things to sort of think about, and it's not on our list that we talked about. So thank you, Laura, for bringing that up. I think that's really important. Let's see. Let's just talk about blood pressure real quick. There's a question about, hey, what if my blood pressure is 140/60? And, all of these sort of like little details of, is it this number or a little bit higher or a little below the level? It honestly, it's kind of hard to say, what is the exact number that you should have. But it is important. I think the best advice is, if you're taking a blood pressure medication or you've had a history of high blood pressure, is to get a home blood pressure cuff and check those numbers, because those numbers are going to be variable over time, not just over time like week to week, but also throughout the day. So checking it, in the morning, checking in the evening, seeing where your blood pressures are. And really what you want to know is kind of what's your average. So if your blood pressure is running 140/90 on average, that's probably a little too high, and it probably puts you at a higher risk because it's pushing more back on your heart. It's causing more work for your heart over time. So it may be a reason to think about cutting back on salt, thinking about if your medications need to be adjusted, that sort of thing. This specific question may relate to sort of having a high systolic blood pressure, that top number, and a low diastolic blood pressure, that lower number. But if your systolic blood pressure is high at like 140 or higher, then it's probably a little too high because your heart is still having to push against that blood pressure. Okay. Let's see if there's anything else. I think, I touched on as many of those little things that we could. A few of these questions I'll try to still answer by typing to you guys. But let's take a little break. We have about 9 minutes until the next session. So get up, stretch a little bit, keep moving. That's an important thing. Stretch your legs, stand up. And if you were going to stick around and check out the next talk, which is one of my talks also on continuous glucose monitoring in type 2 diabetes. I know it's something we've talked a lot about today, but it's a really important one. If you're going to stick around, you can just stay on this link. You don't even have to sign out. We'll be resuming right here at 1:45 Central Time. So it'll be about 8 minutes from now. Okay, thanks guys.